My name is Harold Yoon. I am a radiation oncologist with Cancer Care Specialists of Illinois, serving patients in the Decatur area. I went to undergraduate at Yale University, then my medical degree at the University of Illinois. I was in Champaign and also in Rockford. I did my specialty training in Brooklyn, New York at the State University of New York. First of all, I was drawn to taking care of cancer patients. They're very complex, they come with a lot of issues, and it's just a privilege to be in the situation where I can help people. In terms of radiation, this is a local treatment, and I very much like thinking in the local area, how to treat a certain area of the body that's also rewarding. It's very technology heavy. I like math and science. There's a lot of physics involved, computers. This all comes together so that I can design the right treatment. These are the areas, aspects of why I was drawn to this particular field. So in terms of what to expect, radiation is an X-ray treatment. It comes from a machine, very similar to an X-ray or a CAT scan. The experience is that you lie on the table, the machine works around you and over you. You're not enclosed, it's not a tunnel or anything like that. You don't feel it, and it's completely painless. Usual radiation treatments last about 30 minutes a day, 5 days a week, Monday through Friday, for a number of weeks. It could be about 2 weeks, or it could stretch longer than that. I think the most important thing in terms of partnering with the physician is to be as engaged as possible in the whole process. So I understand that when a patient first comes to me, there's going to be a lot of confusion, there's a lot of knowledge that's not known, they might be in shock, upset even at the diagnosis, and I understand all that. But the most important thing is to keep the lines of communication going. And so wherever you are as a patient, where you understand, where your level of understanding is, how you are feeling about the situation, that's where I want to meet you as a physician and help you from that point. Well, cancer treatment is always changing, and that's a great thing because research continues at a very rapid pace. When I started, there were a lot of cancers that really didn't have much hope. People rarely survive different types of cancers, for example, melanoma or kidney cancers. Now, fast forward to the present day, we're seeing a lot more long-term survivors, people who are actually beating this disease. That's really encouraging to see the results of research, patients undergoing clinical trials, new treatments becoming available. We're seeing that even radiation can be used in more powerful and safe ways so that there are more cures and patients have a better quality of life. Radiation therapy and radiation oncology is very much involved in research, and I am one of the investigators at Cancer Care Specialists of Illinois. What that means is that many of the research trials that are sponsored and funded by the National Cancer Institute, federal funding, is available here in Decatur, and that's not something that's available in many other communities. So I'm very enthusiastic and glad to offer these clinical trials to my patients, and patients have an opportunity to be involved in research. This is not an expectation or requirement, but we just are able to offer that next level of treatment that research can provide. Research consists of various clinical trials. Depending on the type of cancer, what stage you are, and what kind of question we're trying to answer. For example, is a certain treatment better? Can we decrease side effects with a certain treatment? So depending on that question, then a clinical trial is created. So it has to be done in a controlled manner, meaning you only need a certain type of patients for a trial, you need a certain number of patients, and the treatments in that trial are very carefully controlled so that you can answer a specific question. And so the patients who are in the trial, they go through that clinical trial, the type of research and treatment, and then afterwards we make a decision whether that trial was successful. My proudest moments are when I feel like a connection has been made with the patient. So this could be at the beginning of the journey when maybe there's an acknowledgement or a relief that I can understand where they are and what they're experiencing, what they're thinking and feeling. It could be during the treatment when they're so glad that they're finally doing something and going through treatment to get better. And then finally, it could be at the end of treatment as a survivor and they've beaten this thing or they've achieved their goals, and the satisfaction of knowing that we've done that together and we've made that journey together. Those kind of connections are really what makes this job so rewarding.